The Journal of the American Medical Association has just released the results of a 3-decade study on the health effects of alcohol on women. They show that as few as 3 drinks a week can lead to an increased risk of breast cancer. But earlier studies found that moderate alcohol consumption may help prevent heart disease. If you're confused, so were we. So we asked Dr. Jon LaPook to look into it.
Today's study added confusion about the role of alcohol in women's health. It shows even a moderate amount may increase the risk of breast cancer. Study author Dr. Wendy Chen.
What was new about our study is that we had enough statistical power to look at the effect of lower levels of alcohol consumption and breast cancer risk.
More than 100,000 nurses were followed for nearly 3 decades. Compared to non-drinkers, women consuming the equivalent of 3 to 6 glasses of wine a week had a 15% increased risk of invasive breast cancer. For every 10,000 women, that translates to an additional 52 cases of breast cancer over 10 years. But a previous study of the same group of women found that roughly the same amount of alcohol may lower the risk of heart disease. So where does that leave women?
They don't need to stop drinking altogether. And in terms of breast cancer risk, to minimize her drinking, we would recommend that she consume alcohol of several glasses, several drinks per week or less.
If you're wondering what several drinks means, Dr. Chen told us there's no hard cutoff, meaning the study provides more of a guideline than a set of absolute rules.
John, this is one of those studies that is so infuriating because you don't know what to do with it. In a practical sense, what is a doctor and a patient supposed to do with this information?
I'll tell you exactly what I told my patient this morning. Okay, middle-aged woman, very strong family history of breast cancer. She said she drinks 2 to 4 glasses of wine a week. I discussed the study and I said, look, it probably makes sense to stay on the low end of that. Now, if it had been the other way around, she had a very strong family history of heart disease with increased risk, I might have changed that equation. I gotta be honest with you though, Scott. No doctor knows exactly what to recommend. It's as confusing for us as it is for everybody else.
John, thank you very much.